Hypervolemia and hypovolemia are two conditions that refer to abnormal fluid volume in the body. 1. Hypervolemia. Definition: hypervolemia, also known as fluid overload, occurs when there is an excessive fluid volume in the intravascular and interstitial spaces. Causes: hypervolemia can result from various factors, including heart failure, renal failure, excessive administration of intravenous fluids, excessive sodium intake, or the use of certain medications such as corticosteroids. Signs and symptoms. Common signs and symptoms of hypervolemia include edema, swelling, weight gain, distended neck veins, increased blood pressure, bounding pulse, shortness of breath, crackles in the lungs, and changes in mental status. Nursing interventions. Treatment of hypervolemia involves identifying and addressing the underlying cause. Nursing interventions may include monitoring vital signs, strict intake and output measurement, administering diuretic medications as prescribed, restricting fluid and sodium intake, and elevating the edematous extremities to promote fluid reabsorption. Complications. If left untreated, hypervolemia can lead to serious complications such as pulmonary edema, fluid accumulation in the lungs, congestive heart failure, and organ dysfunction. Diagnostic tests. Diagnostic tests that may be used to confirm hypervolemia include blood tests, such as electrolyte levels and renal function tests, echocardiogram, to assess heart function, and chest X-ray, to evaluate pulmonary congestion. Dietary modifications. Dietary modifications for hypervolemia often involve reducing sodium intake, as sodium promotes fluid retention. Patients may be advised to limit their consumption of processed foods, canned foods, and foods high in salt. Medications for hypervolemia. Diuretics. Diuretic medications are frequently prescribed to promote diuresis and reduce fluid volume in hypervolemia. The specific type and dosage of diuretic will depend on the patient's condition and individual needs. Commonly used diuretics include loop diuretics. Examples include furosemide, Lasix, and bumetanide, Bumex. They act on the loop of Henle in the kidneys to inhibit sodium reabsorption, leading to increased urine output. Thiazide diuretics. Examples include hydrochlorothiazide, microzide, and chlorothiazide, diuryl. They work on the distal convoluted tubules in the kidneys and promote sodium and water excretion. Potassium-sparing diuretics. Examples include spironolactone, aldactone, and triamterene, direnium. These diuretics have a weaker diuretic effect but reduce potassium loss, which can be beneficial in patients at risk of hypokalemia. Vasodilators. In some cases of hypervolemia, medications that promote vasodilation may be used to reduce fluid volume and relieve symptoms. Examples include nitroglycerin, hydralazine, and nasiratide. These medications help dilate blood vessels, reducing preload and afterload on the heart. 2. Hypovolemia. Definition: hypovolemia, also known as fluid volume deficit or dehydration, refers to a decreased fluid volume in the intravascular and interstitial spaces. Causes: hypovolemia can result from causes such as excessive fluid loss from vomiting, diarrhea, excessive sweating, hemorrhage, inadequate fluid intake, or the use of diuretic medications. Signs and symptoms. Common signs and symptoms of hypovolemia include thirst, dry mucous membranes, decreased urine output, concentrated urine, dizziness, hypotension, increased heart rate, weak peripheral pulses, cool and clammy skin, and altered mental status. Nursing interventions. Nursing interventions for hypovolemia focus on fluid replacement. These may include administering intravenous fluids, monitoring vital signs, assessing intake and output, encouraging oral fluid intake, and identifying and managing the underlying cause of fluid loss. Fluid replacement. The primary intervention for hypovolemia is fluid replacement therapy. This involves administering intravenous fluids such as isotonic solutions, e.g., normal saline, to restore fluid volume. Oral rehydration. In cases of mild hypovolemia, oral rehydration solutions containing electrolytes and water may be sufficient to restore fluid balance. These solutions are commonly used for treating dehydration caused by vomiting and diarrhea. Monitoring electrolytes. Hypovolemia can disrupt electrolyte balance, so monitoring electrolyte levels, such as sodium, potassium, and chloride, is important. Electrolyte imbalances may need to be corrected through appropriate interventions. Preventive measures. Nurses play a vital role in preventing hypovolemia by promoting adequate fluid intake, especially in vulnerable populations such as older adults and individuals with chronic illnesses. Education regarding the importance of staying hydrated during illness or in hot weather is crucial. Medications for hypovolemia. Intravenous fluids. The primary treatment for hypovolemia is fluid replacement therapy. Intravenous fluids, such as isotonic solutions, are commonly administered to restore fluid volume. Examples include normal saline, 0.9% sodium chloride, lactated Ringer's solution, and balanced electrolyte solutions. Blood products. In cases where hypovolemia is due to significant blood loss, blood transfusions may be necessary to restore fluid volume and maintain adequate oxygen carrying capacity. Packed red blood cells, fresh frozen plasma, and platelets are examples of blood products that may be administered. Medications to treat underlying causes. Hypovolemia may be caused by specific conditions or factors that require targeted treatment. For example, if hypovolemia is due to excessive vomiting or diarrhea, antiemetics or antidiarrheal medications may be prescribed to control symptoms and prevent further fluid loss. In both hypervolemia and hypovolemia, it is important for nurses to monitor the patient's fluid status closely, assess for any changes in clinical signs, and intervene promptly to provide appropriate care.